Good afternoon, everyone, and welcome. My name is Dr. Philip Phillips, and I'm the Associate Dean of the University Honors College. I'm pleased to welcome you to our Spring 2021 Honors Lecture Series on social justice. We have a treat in store today. We have not one, not two, but three speakers, all of whom are with our Department of Social Work here at MTSU, and they have put together a program that I think will be great for everybody. I think we're going to learn a lot today. I want to thank Dr. Dopwell for reaching out to me and for organizing this panel. We're very much looking forward to it. Dr. Dopwell is an assistant professor in the Department of Social Work here at MTSU, and she is currently studying the progress of the COVID-19 pandemic and is in collaboration to develop equitable prevention and treatment of COVID transmission in Shelby and Davidson counties. So I'm going to hand this over to her. The panel discussion will be on social work as social justice, increasing equity within underserved populations. And Dr. Dopwell will introduce our other speakers and take it away.
Thank you very much. And speaking of the work in Shelby and Davidson counties, Dr. Dotson is one of my collaborators within that realm. And we're working to get some interventions, and we'll be talking a little bit about that actually a little bit later, so I don't want to go too far into it. And then Dr. Harden is, again, another member of our faculty here, and she is also the program coordinator for our Master of Social Work program. So we are going to go ahead and get started with some information on what it is to be social work, what it means, the code of ethics that we have to follow as social workers, what that relates to with regard to social justice. And we're going to talk a little bit about history and social work and how all of these things come together and relate to social justice and what we need to do going forward. So first we have our core values, and we have service, meaning that we are expected to do for others. We're supposed to be helping to develop a society in which we are helping people to get to where they need to be. That's individuals, it's communities, it's populations, and so forth. One of our values also is the dignity and worth of the person. So every individual, including those who can be hard for us sometimes to see as individual human beings, every single one is a person. And we as social workers are called to understand that, to recognize it, and to connect with that as we serve. Competence is another value, and that relates to our understanding, our knowledge, our skills. It relates to us knowing what we're doing. And if we don't know something, us having to say that. We cannot engage in behaviors as part of our profession which we are not trained to do. So for example, EMDR, eye movement desensitization and reprocessing. I always forget what the R stands for. It's reprocessing. A person has to know how to do that in order to engage in that process with a client. I don't know how to do that. I understand sort of the basics of it, but I'm not trained in that. I cannot then turn around and do that with someone because that could actually harm rather than help. So we as social workers are required to be informed about what we know and what we don't know, and to be able to inform others, and then to, if we need to do so, to refer out for someone who is able to help someone with a cause or an element that we cannot because we do not know the information. Integrity, we do what we can to the best of our abilities. We do it with a constant understanding and looking inward to understand that we're doing the best that we can with what we have. We're honest. We are clear. We have to be involved in the process of making sure that what we're doing is what we're supposed to be doing. And then there's the connection to human relationships. This is another value. We don't really exist as a population, as a species, without each other. And so our connection to each other is very important, very big, not just as social work, which of course, socio, we're talking about people. But in general, we don't survive and we don't thrive without each other. And social work recognizes that and acknowledges that. And you'll notice perhaps that I left social justice, which is right in the middle there, to the end, because that's what we're talking about today. And justice is about making sure that things are equitable. And what that means is that when something goes wrong, we make sure that we are helping people at the level that they need to, that they need in order to get to where they need to be. For example, with the pandemic, we'll talk a little more about that too. There's so much that's going on in this world that requires more of an even understanding, more of an even resource acquisition, knowledge sharing, and so forth, that we don't necessarily see. As social workers, we are meant to challenge injustice. We are meant to challenge those moments of unfairness. That's really what it boils down to. And social justice is sort of our overarching goal, but it's also those steps we take toward reaching those overarching goals. So now we'll talk about the promotion of equal access. And I believe that that was Dr. Harden.
Dr. Dotson, feel free to jump in. I think we were gonna kind of all share a couple of those slides. So and as Dr. Dopwell said, our foundation, the house from which we build, our foundation is social justice. Everything around social work is related and interconnected with social justice. That is what differentiates us from other helping professions, particularly say, and I have a degree in psychology, so I'm not at all adverse to that, appreciate that, but with the emphasis on the individual versus person and environment. And so we move more towards the larger sort of picture. And we have 5 priorities for our profession right now. And those priorities are generally set out by our national membership organizations, for example, the National Association of Social Workers, which lobby on our behalf. So right now, our priorities include voting rights, criminal justice, juvenile justice, environmental justice, immigration, and economic justice. And Dr. Dotson, you want to elaborate any on those? You're on mute.
Thanks. Just to reemphasize that from a social work perspective, social justice is the lens that we look through. So we're looking at or focusing on meeting human needs and developing human potential and resources. So part of our work, or most of our work, is promoting social justice and social change on behalf of individuals, groups, communities, and even organizations. So we aim to improve human well-being and help to satisfy fundamental human needs of all people, not just a set of people, but for all people, with special regard to their needs and empowerment of people, especially those who are vulnerable, oppressed, living in poverty, and in this current environment, our elderly population, which we will speak more on a little later. Thank you, Dr. Harden.
Okay. Let's see, can we move to the next slide? There we go, thank you. So we're gonna just highlight a couple of projects we've got going on, and in no way does this say that these are the only areas of our research and activities and advocacy. But right now I wanted to talk a bit about a project that we actually have going with in collaboration with criminal justice and with Rutherford County. So kind of keeping it local. Myself and Dr. Ben Stickle in criminal justice wrote a grant a few years ago for Rutherford County to help provide services in their local correctional work center. That's different than their jail. It is for people who are misdemeanors. In other words, you're in prison or you're in jail for up to 12 months. So it's folks with maybe a lot of low-level types of, I guess, interactions with law enforcement. I want to talk for a minute of why those kind of programs are important with regard to recidivism, some of the risk factors for prison that we work with, and including trauma, and then, you know, kind of this project around reunification. I'm going to watch my time because we only have a bit of time to go over a pretty big program. But one thing that probably would be important to understand is that, you know, about 80% of criminals or people who have been incarcerated actually end up back in the prison system. Part of the issue has to do with addiction and co-occurring mental illness. Well, we found that a large percentage of people in prison, in jails, have co-occurring mental health conditions as well as addiction. Now, it's probably pretty easy for you to think about that drug-involved folks tend to end up in our jail system a bit more often than other people. As a matter of fact, I'll just give you, I'm not going to go into all the data that we used as part of this project, but like, for example, TBI reported 2,300 drug-related arrests in Rutherford County in 2017. Drug and narcotic offenses ranked 4th among all offenses and 10% of the total arrests for our county. Now, I said 2017 because the data is really that far behind, unfortunately. So the information we get from the TBI and from the Bureau of Justice is so many years behind. So just kind of have that in the back of your mind. Unfortunately, I can't tell you what's happening in 2020. I wish I could. Although the report that we use oftentimes will say 2020 or 2021 on it. So just know that a great proportion of arrests occur related to drug offenses. That includes, you know, people who are trying to deal with an addiction as well as sell and distribution. So that's something to have in the back of your mind. That's a risk factor for incarceration and recidivism. Those are things that we look at. So from a social justice lens, we want to think about what do we do to remediate these issues? For example, more treatment opportunities, more re-entry programs in our jails to help people get acclimated to returning to their community. One of the studies that I worked on showed that the one single factor in reducing recidivism was jobs. So if we could help people get jobs in the community, they were much less likely to go back to jail. So this project in particular looks at trauma, because that's another risk factor. I know we don't really have time to ask a bunch of questions, but some of you may have heard of the adverse childhood experiences studies that have occurred. The sort of seminal study was with Folletti and a group of people out of Kaiser Permanente. So they took a look at what is it that, you know, what kind of experiences do we have in childhood that we could identify as potential trauma? They looked at several things and they categorized it as abuse or household challenges or neglect. And that might include like emotional, physical, sexual abuse. Mother was treated violently, substance abuse in the household, parental separation, and incarceration of a household member were examples. What we have found is that children who have incarcerated parents are much greater risk of actually being incarcerated as adults. They get more acclimated to the environment. When they're visiting their parents, for example, in the jail, the smells, the sights, the sounds became part of their lives, as well as risk factors related to not having that parent present and the possibility of the parent having an addiction or mental health condition, which is contributing to their potential incarceration. So all these things kind of become a domino effect, unfortunately. And so this particular project, and you guys tell me when, somebody wave, because I could talk about this all day, and I do sometimes, so forgive me. So what we look at in this project is how to help encourage, keep, or nurture the parental-child bond while the parent is incarcerated. Now, some of the parents in the jail system here or the work center that we're working with have never had a bond with their child, have maybe never even lived with their child. However, the program seeks to help establish those bonds and or involve that person who's incarcerated. So we bring in a program through the family center. They work with the child and the incarcerated parent and whoever the caregiver is on the outside. The cool thing about this program is it helps the child to see the parent in a different light. So for example, when we have the groups, the parents are allowed to dress in street clothes rather than in their jumpsuits and in their clothing that they normally would wear in the prison system or the jail. The children are allowed to touch the parent. They can hug, they can sit on their laps, they can interact in a way that would be typical of a parent-child relationship. And then they go through classes together and they do activities together. Now, as you can imagine, COVID has caused a little bit of a problem with that. So we've been doing a lot on Zoom. But the overall process here is to help children and families to stay together or to reunite so that when that person leaves incarceration, they have an actual potentially healthy or at least somewhat healthy attachment being formed, and they can continue these services out in the community. So that is one of the projects that we are looking at that looks at the broader picture of social justice and then dives down into actual services for families.
Thank you, Dr. Harden. And I can listen to that all day. I love the project. I think it's amazing, and we need more. That being said, moving on a little bit to our work here, COVID-19 with disenfranchised communities. I've been studying COVID-19 in general, since it hit pretty much. And I'm doing work elsewhere I'm trying to get out to Puerto Rico as soon as it's safe to do so and do some recovery there. But Dr. Dotson and I are working here in trying to get some activities to address disparities here in Tennessee. So our communities which are most adversely affected tend to be those of the African and Latinx communities rather than say the white communities. Poverty is a relation to adverse effects. Your rural versus urban, but even within urban sites, if you're looking at sites which are more financially bereft than others, you're going to see higher rates of the cases of COVID as well as the deaths. So Shelby and Davidson counties are the ones with the highest numbers and consistently have been. As of yesterday, Shelby, which has the highest of the both, was 87,879 as far as total cases, and the deaths were at 1517. And for Davidson, it was 82,125 cases with 874 deaths. Now, the things that are in relation to these two pieces are these are urban areas. These are places where there are more people living in smaller places, smaller spaces, closer together, and there are more people of color in these areas as well. So those are parts of the numbers being affected. The top 5 in this state are rounded out by Knox, Hamilton, and Rutherford counties. So just so you know, MTSU is right there in that space. And we really need to be working on addressing that. So there is need for more equitable interventions. And I wanted to sort of turn this over to Dr. Dotson to talk a little bit about what we're doing and trying to do and so forth.
Sure. As Dr. Dotwell mentioned, those numbers in those communities, it's very alarming, considering where we're located in the center of the US and the center of the Southeast. But we're looking at interventions that are more community-based. So in particular, we're looking at a model that's called hallucinogenics model, and it's community-based and it's focusing on the individual need of the communities rather than the medical aspect, right? So if we focus on getting individuals things that they need earlier on, better housing, better healthcare, access to food, to healthcare, to the vaccine, to be tested, then perhaps some of these other medical issues would have been decreased. So we're looking at partnering with not just social workers, but partnering with other professionals in the community to see how we can provide more equitable services. So, if you have a group of people, you tend to be able to do more work than one or two alone. So partnering with individuals from the healthcare profession, from our policymakers, and most certainly getting the voice from the community, seeing what are the resources that they need. For instance, I think in particular, a population that has been hit the hardest has been our elderly community, right? And so you hear the commercials and the radio ads say, go to www.something and sign up. Well, the likelihood that that population can do that is not great, right? So one, we have to understand where they are in their journey. One, they're not tech savvy. Two, they don't trust technology at all, right? And they need human contact. So we have to find out what are some of the most equitable ways to reach the various populations that are being most affected, whether it be the elderly, whether it be individuals who are in poverty, whether it may be people who are isolated and maybe in the rural communities. But one solution is not all for all, right? So we have to have multiple solutions going on at the same time for all of these different groups. So we're doing a collaborative approach, hoping to work with individuals in Shelby and Davidson County. We're looking at what are some of the ways that we can get information out to our communities in a quicker fashion. Maybe one model in particular to look at is what has happened in Davidson County. For the African-American community, they have really collaborated with religious institutions and structures. That has been the structure that has actually brought the testing to the community in partnership with Meharry, for instance. That's a model that could be utilized probably in any section of Tennessee, but it's just about providing those collaborative structures, putting them in place, talking to the individuals in the community about how do they need to get access to the information. Is it an app? Is it a message in a bottle? Is it a billboard? But what do they relate to best? Not what we think, but what they need, right? So we're looking at what the needs are best for those community members.
Yeah, I like the message in a bottle. I'm a big fan. So, when we're talking about these things, one of the elements that we need to keep in mind is, as Dr. Dotson mentioned, we have to be going based on what is right for the community we are serving. And each community is going to be different in some capacity or another. And there are going to be some sort of overarching elements, but everyone's going to have something different. And, you know, Dr. Dotson mentioned the food thing. You know, one of the health related, health promotive actions, which have been advised, you know, to us, oh, well, you should do this. Okay, this is great, is to eat healthy foods. And well, that's great if you are living in a space and you have the financial wherewithal to access healthy foods. But if you live in an area where we call them food deserts, right, where the food's not available, or by the time it gets to you, it's no longer healthy, even if it was when it first got on the truck, then there's an issue of access. And just the fact that I want to eat healthy doesn't necessarily mean I can. So that is, again, bringing us back to the concept of justice. It is an injustice for us to know, and we do know, that there's an issue of food insecurity, and that issue of food insecurity then causes and compounds this connection to disease, not just to COVID-19, but to diseases of all types. So we know what needs to be done. So what are our lessons then? I think the first lesson is we need to do it. We know that masks help. We know that social distancing helps, or physical distancing. I prefer to social, it doesn't. And we know that eating healthy helps. We know that access to equitable health insurance, health opportunities helps. What we also know is that those things are not equal for everyone. Everyone does not have equal access to exactly what they need in order to combat something like COVID-19. And we need to change that.
Right.
What are
And some other lessons, I mean, we are saying that the recent pandemic is really a history lesson unfolding before our eyes, right? So it's teaching us a lot. And so what are some of the things that we need to do to support some of our most vulnerable populations that continue to be compounded with social issue after social issue? For instance, in our own state, just putting it out there, maybe there's not a lot of leadership structure to support the health disparities and health equity. There are 95 counties in Tennessee, and all 95 counties are doing something different. And it may not be working for one, so one county could learn from the other. So are they really talking? Right? So it's all about collaborating, finding out what not one neighborhood or one community is doing. You could tweak it to work for your community, but having no plan is not the plan, right? So we need some type of plan and for someone to step up. And so we also know that when we study and review our history, it gives us an opportunity to review from the past, to better understand present conditions and situations, and an opportunity to learn from accomplishments and mistakes to do better in the future. There was the 1918 pandemic, almost similar to what we're experiencing now, right? But of course, they didn't have access to some of the things we take for granted but they automatically went to outdoor social distancing to deal with the pandemic. We didn't do that at first, right? We were scrambling. So we could have learned from as far as 1918 and just brought it up to current day times to make it fit. So looking back at our history, just to see what were mistakes, what were accomplishments, and apply them to current day. Just a simple lesson and moving forward to provide an equitable situation for all.
Absolutely. So that actually brings us to the fact that this is Social Work Month on top of the concept of social justice and yes, so Social Work Month, it's a month for us to be able to really network with other social workers, to understand, for our students to understand a little bit more about what it means to be a social worker, and to be within this realm. We have at the end of the month Social Work Day on the Hill, where we, well, usually would descend upon Nashville. We're going to descend upon Zoom, but talking about those kinds of issues which are important to social justice. And our theme for this year is social workers are essential. And we're essential to so many different elements, different realms of the world. You see us, and Dr. Harden was talking before about, you know, where we could see social workers in the schools, we see social workers in the hospitals, we see social workers in DCS, we see social workers as clinical workers, we see social workers as community action workers, social workers as professors. So we're all over the place. And, you know, I think the way that I say it when I'm talking to my students is that my overarching goal, my sort of pie in the sky goal, is to be put out of business. Because if I'm put out of business, then I'm no longer needed. And that means that justice has been served in every particular corner possible. And I want that. So here we're going to go into final thoughts. And Dr. Harden, do you want to go ahead?
Oh, certainly I can do that. So one of the things that we put on our initial slide was about historical trauma. And that may seem like a completely separate sort of topic for many of you, but the reality is everything that we do is connected to historical trauma. So some work I'm doing right now with the Federal Writers Project, Narratives of Enslaved Africans, the last known living enslaved Africans, really brings that home for me. They talk a lot about some of the abuses and some of the physical abuse, that type thing I was sharing with Dr. Dotson and Dopwell earlier today, some of the quotes that could have been pulled from today's world, unfortunately. Things like, you know, he was beating me in the head. They were, you know, stomping on my face. Those kind of things, unfortunately, are still occurring today. But what I also know, and what I will close by, is to say that we have to understand our past to know where we are now and to know where to go in the future. And as hard as some of our past is to reconcile, as hard as it is to look at and to own, we have to do that in order to repair, rebuild, and move forward. And that, I think, is a calling for all of us, regardless of race, regardless of ethnicity, gender, sex, whatever it is. We have to come together from that perspective.
Dr. Dotson, did you want to say a few words?
Just going back, you know, I'm a big history buff. And again, as Dr. Harden said, historical trauma didn't start 10 years ago, 15 years ago, yesterday. Technically, if you want to go back to history, go back to the Middle Passage, right? Go back to the Middle Passage when African descents were brought to America. That's when historical trauma began for African Americans in this country. And some of the injustices and inequitable situations are still occurring, still having a housing issue, still having an economic issue with finding employment, still being represented for who you are and whom you are, being accepted, getting access to resources. It even makes me go back to think when African Americans were late in Texas getting the message that they were free, right? That was a totally inequitable situation. How did everyone else in America know except for that particular group, right? So it's just constantly thinking about how can we not repeat these past mistakes and make sure that we have everybody at the table, right? That's what equity means. Everybody's at the table and has an equal voice and an equal opportunity to share and receive.
And I'm just going to say one short thing. I was looking at the word justice and I realized something. Justice cannot be spelled without us. And so I want you to consider that, think about it, and maybe take that home with you and see where that leads you going forward. Now, we open it up for any questions.
Thank you for an outstanding presentation, all three of you. We're really, really grateful. Our speakers have allotted time, everybody, for questions. So please ask questions or comments.